I had a lump appear on the outside of my throat, and I was taking medication, and after about 10 days, nothing happened. It didn't go away. My daughter is a good friend with Dr. Barnes' sister, and she said, "You're not going any place except to the Cancer Center and to Mac Barnes."
Our evaluation of a patient always begins with their symptoms. And as we go through that, we focus on their examination, and if we find an enlargement of a lymph node or a mass in the abdomen or something like that, then we usually do some imaging to determine if there's abnormal tissue present.
And it was non-Hodgkin's lymphoma.
Well, non-Hodgkin's lymphoma really are a diverse group of different types of lymphoid cancers. And she had a type that's very treatable and often curable with chemotherapy treatments. And fortunately, she was in relatively good health, and her amount of lymphoma in her body was relatively small. And so when we treated her, she did very well and went right into remission.
He is so compassionate and caring, and when I would leave every time, he would say, "Now, you know, if you have any questions or you need us, just to call." My daughter and 3 of my friends came with me every appointment. The room was full. He would walk in and it was just full, but he talked to us and explained things, and if any of them had a question, he was so caring. He answered it in detail, and it just made you feel really comfortable. And I never doubted I'd get well.
A couple of years later, she came out of remission and had a relapse.
And I had a large growth on my right tonsil, and it turned out to be lymphoma also.
And there was a new cancer drug that we had called rituximab, which is a monoclonal antibody that's really been a very important part of lymphoma treatment. We were able to retreat her with that particular drug, and she's been in remission ever since.
And it took me a little while to get back on my feet, but I have friends I travel with, and I've traveled to Italy, and I've taken a cruise, and I've made it to my 75th birthday.
I think the most important thing is to understand that there are advances being made every day in the treatment of cancer. We have a number of cancers now we can cure that we couldn't cure a few years ago. The other thing is that we have many good treatments that help reduce the side effects of both chemotherapy and other cancer treatments. And the Cancer Center idea and execution of the model really didn't occur until the late 1980s, when we realized that there were so many new and upcoming treatments for cancer, and that they were going to be better, and that patients needed a place that was dedicated to their care, that we really developed and executed the model that became the Montgomery Cancer Center.
They made me feel so comfortable, and I was so confident that what they were doing was working and that I would be all right. And I am, 11 years later.